Nutrition, which is also called nourishment or ailment, is the provision of the materials necessary in the form of food to the cells and organisms in order to support life. Many common health problems can be prevented or alleviated with a healthy diet. The diet of an organism is what it eats, what is largely determined by the perceived palatability of the food. A poor diet can have an injurious impact on health, causing deficiency diseases such as scurvy and Kwashiorkor, health-threatening conditions like obesity and metabolic syndrome, and such common chronic systemic diseases like cardiovascular disease, diabetes and osteoporosis. Nutrients. There are 6 major classes of nutrients like carbohydrates, fats, minerals, proteins, vitamins and water. These nutrient classes can be categorized as either macronutrients that are needed in relatively large amounts or micronutrients which are required in smaller quantities. The macronutrients include carbohydrates including fiber, fats, protein and water. The micronutrients are minerals and vitamins. The macronutrients excluding fiber and water provide structural material like amino acids from which proteins are built and lipids from which cell membranes and some signaling molecules are built, as well as energy. Some of the structural material can be used to generate energy internally, and in either case it is measured in joules or kilocalories, often called calories and denoted as capital C. Carbohydrates and proteins provide 17 kilojoules approximately, that is 4 kilocalories of energy per gram, while fats provide 37 kilojoule, that is 9 kilocalories per gram, through the net energy from either depends on such factors as absorption and digestive effort, which vary substantially from instance to instance. Vitamins, minerals, fiber and water do not provide energy, but are required for other reasons. A third class of dietary material, fiber, which can be recognized into 2 groups, water soluble, for example pectin, and water insoluble like cellulose, hemicellulose and non-carbohydrate substances are also required for both mechanical and biochemical reasons. The water soluble fibers are important for reducing cholesterol and LDL levels. The importance of dietary fiber is that it increases the bulk of the contents in the colon, partly by its own volume and partly by uptake of water. This helps in increasing bowel movement, facilitating defecation. Molecules of carbohydrates and fats consist of carbon, hydrogen and oxygen atoms. Carbohydrates range from simple monosaccharides like glucose, fructose, galactose to complex polysaccharides like starch. Fats are triglycerides made of assorted fatty acid monomers bound to glycerol backbone. Some fatty acids, but not all, are essential in diet. They cannot be synthesized in the body. Protein molecules contain nitrogen atoms in addition to carbon, oxygen and hydrogen. The fundamental components of protein are nitrogen containing amino acids, some of which are essential in the sense that humans cannot make them internally. Some of the amino acids are convertible with the expenditure of energy to glucose and can be used for energy production just as ordinary glucose in a process known as gluconeogenesis. By breaking down existing protein, some glucose can be produced internally. The remaining amino acids are discarded primarily as urea in urine. This occurs normally only during prolonged starvation. Other micronutrients include antioxidants and phytochemicals, which are said to influence or protect some body systems. Their necessity is not as important as vitamins. Recommended daily allowances which is abbreviated as RDA. RDA of nutrients was first developed in 1943 by the National Research Council and National Academy of Science, USA. It is a liberal but safe estimate of the daily intake that would meet the nutritional demands of most healthy people. A normal diet must contain adequate amount of protein, carbohydrates, fats, minerals in suitable proportions and ample vitamins. According to RDA, the protein intake of the healthy adult person must not be less than 1 gram per kg body weight. Pregnant and lactating females need 1.5 to 2 gram per kg body weight of the protein. The recommended amount of fat in the food is 75 gram per day. However, it is suggested that middle-aged people leading to sedentary life may take a diet with reduced fat content. In adults, the daily requirement of carbohydrates is 300 to 500 gram. Most foods contain a mix of some or all of the nutrient classes together with other substances such as toxins of various sorts. Some nutrients can be stored internally, for example, the fat soluble vitamins, while others are required more or less continuously. Nutritional diseases. Nutritional diseases are commonly associated with chronic malnutrition. Additionally, conditions such as obesity from overeating can also cause or contribute to serious health problems. Excessive intake of some nutrients can cause acute poisoning. Metabolic diseases. Obesity. Obesity is caused by consuming too many calories compared to the amount of exercise the body is performing, causing a distorted energy balance. It can lead to diseases such as cardiovascular disease and diabetes. Obesity is a condition in which the natural energy reserve stored in the fatty tissue of human and other mammals is increased to a point where it is associated with certain health conditions or increased mortality. Vitamins and micronutrients. Vitamin poisoning is the condition of overly high storage levels of vitamins which can lead to toxic symptoms. The medical names of the different conditions are derived from the vitamin involved, and excess of vitamin A, for example, is called hypervitaminosis A. Iron overload disorders are diseases caused by the overaccumulation of iron in the body. Organs commonly affected are liver, heart and endocrine glands. Malnutrition. Protein energy malnutrition or protein calorie malnutrition. It refers to a form of malnutrition where there is inadequate protein intake. Kwashiorkor, which is associated with protein malnutrition predominant. Kwashiorkor is an acute form of childhood protein energy malnutrition characterized by edema, irritability, anorexia, ulcerating dermatosis and an enlarged liver with fatty infiltrates. The presence of edema caused by the poor nutrition defines Kwashiorkor. History. Jamaican pediatrician Dr. Cicely D. Williams introduced the name into the medical community in her 1935 Lancet article. The name is derived from the Ga language of coastal Ghana, translated as the sickness the baby gets when the new baby comes, and reflecting the development of the condition in an older child who has been weaned from the breast when a younger sibling comes. Breast milk contains proteins and amino acids vital to a child's growth. In at-risk populations, Kwashiorkor may develop after a mother weans her child from breast milk, replacing it with a diet high in carbohydrates, especially starches, but deficient in protein. Now, having a look at the symptoms. The defining sign of Kwashiorkor in a malnourished child is pedal edema, that is swelling of the feet. Other signs include a distended abdomen, an enlarged liver with fatty infiltrates, thinning hair, loss of teeth, skin depigmentation and dermatitis. Children with Kwashiorkor often develop irritability and anorexia. The causes. There are various explanations for the development of Kwashiorkor. It is accepted that protein deficiency in combination with energy and micronutrient deficiency is necessary but not sufficient to cause Kwashiorkor. The condition is likely due to deficiency of one of several types of nutrients, for example, iron, folic acid, iodine, selenium, vitamin C, etc., particularly those involved with antioxidant protection. Now, having a look at the treatments. Protein should be supplied only for anabolic processes. The catabolic need should be satisfied with carbohydrate and fat. Protein catabolism involves the urea cycle, which is located in the liver and can easily overwhelm the capacity of an already damaged organ. The resulting liver failure can be fatal. Marasmus. It includes deficiency in both calorie and protein nutrition. Marasmus is a form of several protein energy malnutrition characterized by energy deficiency and is caused by a severe deficiency of nearly all nutrients, especially proteins and carbohydrates. A child with marasmus looks emaciated. Body weight may be reduced to less than 80% of the average weight that corresponds to the height. Marasmus occurrence increases prior to age 1, whereas Kwashiorkor occurrence increases after 18 months. It can be distinguished from Kwashiorkor in that Kwashiorkor is protein fasting with the presence of edema. Let us have a look at the history. The word marasmus comes from the Greek word marasmos, meaning consumption. Symptoms. The malnutrition associated with marasmus leads to extensive tissue and muscle wasting as well as variable edema. Often common characteristics include dry skin, loose skin folds, hanging over the buttocks, that is glutae, and armpit, that is axillae, etc. There is also drastic loss of adipose tissue from normal areas of fat deposits like buttocks and thighs. The afflicted are often fretful, irritable and voraciously hungry. Marasmus is generally known as the gradual wasting away of the body due to severe malnutrition or inadequate absorption of food. Marasmus is a form of severe protein deficiency and is one of the forms of protein energy malfunction. It is a severe form of malnutrition caused by inadequate intake of proteins and calories. Now, having a look at the treatment. The prognosis is better than it is for Kwashiorkor. It is necessary to treat not only the symptoms, but also the complications of the disorder, including infections, dehydration and circulation disorders, which are frequently lethal and lead to high mortality if ignored. Ultimately, marasmus can progress to the point of no return when the body's machinery for protein synthesis, itself made of protein, has been degraded to the point that it cannot handle any protein. At this point, attempts to correct the disorder by giving food or protein are futile. Dietary vitamins and minerals, either deficiency or excess. Let us have a look at calcium. Deficiency of calcium in the diet may result into severe conditions like osteoporosis or rickets. Osteoporosis. History of osteoporosis. Porous bones is a word derived from Greek osteon meaning bone and poros meaning pore. It is a disease of bones that leads to an increased risk of fracture. In osteoporosis, the bone mineral density, that is BMD, is reduced, bone microarchitecture deteriorates, and the amount and variety of proteins in bone is altered. About the symptoms. Osteoporosis itself has no specific symptoms. Its main consequence is the increased risk of bone fracture. Osteoporotic fractures are those that occur in situations where healthy people would not normally break a bone. They are therefore regarded as fragility fractures. Typical fragility fractures occur in the vertebral column, rib, hip and wrist. Rickets. Rickets is a softening of bones in children due to deficiency of impaired metabolism of vitamin D, magnesium, phosphorus or calcium, potentially leading to fractures and deformity. Rickets is among the most frequent childhood diseases in many developing countries. The predominant cause of a vitamin D deficiency, but lack of adequate calcium in the diet may also lead to rickets. Cases of severe diarrhea and vomiting may be the cause of the deficiency. Although it can occur in adults, the majority of cases occur in children suffering from severe malnutrition, usually resulting from famine or starvation during the early stages of childhood. Osteomalacia is the term used to describe a similar condition occurring in adults, generally due to the deficiency of vitamin D. About the history. The origin of the word rickets is probably from Old English word vricken, that is to twist. The Greek derived word rachitis meaning inflammation of the spine was later adopted as the scientific term for rickets due chiefly to the word's similarity in the sound. Symptoms of rickets include bone pain or tenderness, dental problems, muscle weakness, increased tendency for fractures, skeletal deformity and growth disturbance. In X-ray or radiograph of an advanced sufferer from rickets tends to present in a classic way bow legs, that is outward curve of long bone of the legs and a deformed chest. Changes in the skull also occur, causing a distinctive square-headed appearance. These deformities persist into adult life if not treated. Long-term consequences include permanent bends or disfiguration of long bones and a curved back. The causes. The primary cause of rickets is a vitamin D deficiency. Vitamin D is required for proper calcium absorption from the gut. Sunlight, especially ultraviolet light, lets human skin cells convert vitamin D from an inactive to active stage. In the absence of vitamin D, dietary calcium is not properly absorbed, resulting in hypocalcemia, leading to skeletal and dental deformities and neuromuscular symptoms, for example, hyperexcitability. Treatment. The treatment and prevention of ricket is known as anti-richitic. Treatment involves increasing dietary intake of calcium, phosphates and vitamin D. Exposure to ultraviolet B light, that is sunshine when the sun is highest in the sky, cod liver oil, halibut liver oil and viosterol are all the sources of vitamin D. A sufficient amount of ultraviolet B light in sunlight each day and adequate supplies of calcium and phosphorus in the diet can prevent rickets. Darker skinned babies need to be exposed longer to the ultraviolet rays. The replacement of vitamin D has been proven to correct rickets using these methods of ultraviolet light therapy and medicine. Tetany. Tetany is a medical sign consisting of the involuntary contraction of muscles which may be caused by disease or other conditions that increase the action potential frequency. Muscle cramps that are caused by the disease tetanus are not classified as tetany, rather they are due to a blocking of the inhibition to the neurons that supply muscles. Now, let us have a look at mechanism. Low calcium levels in the bloodstream increase the permeability of neuronal membranes to sodium ions, causing a progressive depolarization which increases the possibility of action potentials. If the plasma calcium decreases to less than 50% of the normal value of 9.4 mg per deciliter, action potentials may be spontaneously generated, causing contraction of peripheral skeletal muscles. The causes. The usual cause of tetany is lack of calcium. Now, let us have a look at diagnosis. Tetany is characterized by contraction of distal muscles of the hands, that is carpal spasm, with extension of interphalangeal joints and adduction and flexion of the metacarpopharyngeal joints, as well as feet, that is pedal spasm, and is associated with tingling around the mouth and distally in the limbs. Iodine deficiency, which is also termed as hypopharamia or sideropenia. Iodine is an essential trace element. The thyroid hormones thyroxine and triiodothyronine contain iodine. In areas where there is little iodine in the diet, typically remote inland areas where no marine food are eaten, iodine deficiency gives rise to goiter, so called endemic goiter, as well as cretinism, which results in developmental delays and other health problems. Goiter. A low amount of thyroxine, that is one of the two thyroid hormones in the blood, due to lack of dietary iodine to make it, gives rise to high level of thyroid stimulating hormone, that is TSH, which stimulates the thyroid gland to increase many biochemical processes. The cellular growth and proliferation can result in the characteristic swelling or hyperplasia of the thyroid gland or goiter. The introduction of iodized salt since the early 1900s has eliminated this condition in many affluent countries. However, in Australia, New Zealand and several European countries, iodine deficiency is a significant public health problem. About the symptoms. Goiter is associated with hypothyroidism or hyperthyroidism, may be present with symptom of underlying disorder, although the symptoms are often unspecified and hard to diagnose. Causes. Worldwide, the most common cause for goiter is iodine deficiency, usually seen in the countries that do not use iodized salt. Selenium deficiency is also considered a contributing factor. In countries that use iodized salt, Hashimoto's thyroiditis is the most common cause. Cretinism. Iodine deficiency is one of the leading causes of preventable mental handicaps worldwide, producing typical reductions in IQ of 10 to 15 IQ points. It has been speculated that deficiency of iodine and other micronutrients may be a possible factor in observed differences in IQ between ethnic groups. Cretinism is a condition associated with iodine deficiency and goiter, commonly characterized bimental deficiency, deaf mutism, squint, disorders of stance and gait, stunted growth and hypothyroidism. Selenium deficiency. Selenium deficiency is relatively rare in healthy, well-nourished individuals. Few cases have been reported. Selenium deficiency in combination with Coxsackie virus infection can lead to Keshan disease, which is potentially fatal. Selenium deficiency also contributes along with iodine deficiency to Cushing-Beck disease. About the history. These diseases are most common in certain parts of China where the intake is low because the soil is extremely deficient in selenium. Studies in Jiangsu province of China have indicated a reduction in the prevalence of this disease by taking selenium supplements. Causes. It can occur in patients with severely compromised intestinal function, those undergoing total parenteral nutrition, those who have gastrointestinal bypass surgery, and also an advanced age people, that is over 90. Alternatively, people dependent on food growth from selenium deficient soil are also at the risk. The symptoms. Often fatal, the disease afflicts children and women of children-bearing age characterized by heart failure and pulmonary edema. Over decades, supplementation with selenium reduces this affliction. Zinc deficiency. Zinc is an essential mineral of exceptional biologic and public health importance. Zinc deficiency affects about 2 billion people in the developing world and is associated with the many diseases. Symptoms. In children, it causes growth retardation, delayed sexual maturation, infection susceptibility and diarrhea, contributing to the death of about 800,000 children worldwide per year. Enzymes with an zinc atom in the reactive center are widespread in biochemistry, such as alcohol dehydrogenase in humans. Treatment. Intake of food products rich in zinc should be increased in the diet. A proper proportion plant dosage of zinc should be consumed in the form of medicine, as consumption of excess zinc can cause ataxia, lethargy and copper deficiency.
Summary. Hence, in this chapter, we have already talked about importance of nutrition, different type of nutrients, recommended daily allowances including different nutritional diseases like obesity, Kwashiorkor, Marasmus, Osteoporosis, Rickets, tetany, goiter, cretinism, selenium deficiency and zinc deficiency, whose understanding gives important contribution to nutritional values and health. Many common health problems can be prevented or alleviated with the help of a healthy diet, and to plan that, it gets important to understand the importance of nutrition and their role. We will learn and discuss about different forms of vitamins and their importance in the next chapter.